Every 40 seconds, someone in the United States has a stroke. A stroke is a medical emergency, and prompt treatment is crucial. Joining me is Chris Decker, registered nurse and manager of Hardin Memorial House Emergency Department. Tell us a little bit about the signs and symptoms of stroke.
Sure. I think I'd love to be able to talk about this because one of really the biggest impact that you can have on a stroke is actually early identification of these symptoms. And not just having and being able to identify those symptoms, but acting upon them. So, one of the American Heart Association and the American Stroke Association, they have what is called a FAST assessment campaign. And that FAST assessment, there's been a lot of commercials that are about it, a lot of community education around the country, and really what that is, it's very easy to use, it's very simple to remember, and FAST, it starts with that F. That F is for facial drooping. So if you are experiencing, or you have a family member or a loved one that's experiencing, or maybe that one side of their face is, the eyelid is drooping or the mouth is drooping, one of the things you can do is you can ask your family member to smile. And if they smile and it's uneven or it's crooked, that can be a sign and symptom of a stroke. The next piece is arm weakness. So one thing you can do is you can ask them to raise their arms above their head. And if they're not able to do that, if you quickly notice that maybe one of their arms they're not able to lift, or maybe they can get it up there, but they can't hold it. So maybe that one arm just kind of drifts down. One of the most common symptoms is one-sided weakness or numbness, and that's definitely a sign of a stroke. The S is for basically speech difficulty. So if you notice that you're having a hard time understanding them, if it's slurred, or sometimes they can't get the words out that they're trying to. So you can ask your family member or loved one, what is a simple sentence, just to repeat, the grass is green or the sky is blue. And if they're not able to do that, sometimes the words may come out completely, just different. That could be a sign and symptom of stroke. And the T, being one of the most critical, is just time. When it comes to strokes, we have a very limited amount of time that we could treat and try to reverse some of these symptoms. And T is for time to call 911. This truly is a medical emergency, and it needs to be addressed in that way. Many times you'll see individuals that come in and unfortunately at Hardin Memorial Hospital, about 50% of our strokes still come in by private vehicle. So they're not utilizing the 911 service. And that happens because people, feel like they're not as bad, or maybe they think they can make it by themselves, or a family member brings them. But what we lose is we lose moments, we lose time, we lose notification. Where EMS services, we have some of the strongest EMS trained services here in our area, and you have men and women that can actually come and use their expertise and treat you in your home or at your store, or wherever you're at, and when it occurs. And that collaboration of them showing up, them starting that treatment, their notification to us, we're able to know what's going on, how long it's been happening, and really hear their assessment and actually start preparing for your arrival. We can get a CAT scan table ready for you. We can have a physician at bedside. We can pull medication. And every bit of that time that we can shave off has a better outcome for the patient. I think unfortunately what you see even at times where people, they try to blow off the symptoms. I'm having this weakness, but I haven't slept well in a few days, and I'm tired, and so I'm just going to go to bed, and I'll wake up in the morning. And they go to bed, they sleep, they wake up, and the symptoms are still there. And unfortunately what we lose that window of time to really try to reverse those symptoms. And what you have is now a lifelong disability that can be from that. And so just understanding the importance of how to identify these symptoms and really acting upon those symptoms can be the matter of life and death or a recovery.
So really, Chris, you're calling out to us. It's important for us to recognize those symptoms sometimes in our loved ones and our friends and family members.
It is.
Time is important, and stroke is a medical emergency. Hardin Memorial Health is an accredited stroke center. We encourage you, for more information, to go to www.hmh.net. And this has been Health in the Heartland.